Okay, so we're going to talk about the next category on the CNA state exam, which is infection control. HAI is the abbreviation for healthcare associated infection. Healthcare associated infections are infections people get while they're receiving healthcare from another condition in any healthcare facility. This is a test question. A healthcare associated infection is also called a nosocomial infection. Nosocomial infections, also referred to as healthcare associated infections, and they are infections acquired during the process of receiving healthcare that was not present during the time of admission. Once again, it's a test question. MRSA is a healthcare associated infection. C. diff or colitis is also called Clostridium difficile. C. diff can also be transmitted from person to person by spores. It can cause severe damage to the colon and even be fatal. It can occur to people receiving care in a healthcare facility. Inflammation of the colon caused by the bacteria Clostridium difficile. Um, Clostridium difficile colitis is inflammation of the colon. It results from disruption of normal healthy bacteria in the colon, often from antibiotics. You must physically wash your hands when providing care for a resident that has C. diff. You cannot use hand sanitizers when providing care for a patient that has C. diff. Urinary tract infections is an example of a healthcare associated infection. And there are five common types of healthcare associated infections. You have your urinary tract infection, surgical wound infections, pneumonia, your skin infection or MRSA, and then the bacteremia or bloodstream infection. Microorganisms are microbes or microscopic life forms. They are so tiny that they can only be seen with a microscope. There are different kinds of microorganisms. You have bacteria, virus, algae, fungus, and protozoa. Antibiotics are used to treat bacterial infections caused by microorganisms. Antibiotics are the agents that produced by one microorganism and killed or inhibits the growth of another microorganisms. It's a medication that's used to treat bacterial infections. A disease-causing agent like a bacterial, a virus, or a parasite is also called a. So we have our pathogens versus our non-pathogen. A pathogen is a microorganism capable of causing disease, and then you have your non-pathogen, which is a microorganism that doesn't cause disease. You have your opportunistic pathogen, which is capable of causing disease when the host resistance is impaired or a person is immunosuppressed, for example. An infection is a multiplication of infectious pathogen agents that are occurring within the body. So next we're going to talk about the chain of infection. The spread of infection can be described as a chain with 6 links. You have first the infectious agents, which is the pathogen. Second, the reservoir, the normal location of the pathogen. And then you have third, the portal of exit um, from the reservoir. And then 4, the mode of transmission. And then number 5, the portal of entry into a host. And number 6 is accessible host. So infectious agents, your infectious agents are pathogens. It include not only bacteria, but also viruses, fungi, and parasites. Then your reservoir is any person, animal, anthropod, plant, soil, or substance, or combination of these in which an infectious agent normally lives and multiplies. Your portal of exit is the means by which a pathogen exits from a reservoir. For a human reservoir, the portal of exit can include blood, respiratory secretions, and anything exiting from the gastrointestinal or urinary tract. Those are definitions for the chain of infection. Communicable diseases. A communicable disease is a disease caused by viruses or bacteria that people spread to one another through contact with contaminated surfaces such as body fluids or blood products. Your non-communicable A non-communicable disease is a disease that is not transmitted directly from one person to another. Hand washing is the most effective way healthcare providers can practice infection control. This is a test question. Disinfection is the process of cleaning something, especially when a chemical is used in order to destroy the bacteria. Test question. You need to know the difference between disinfection and medical asepsis, which is the state of being free from disease-causing microorganisms. Medical asepsis is concerned with eliminating the spread of microorganisms through facility practices. So an example of medical asepsis would be hand washing. That's a test question. Sterile means free from bacteria or other living microorganisms or totally. Sterilization refers to any process that removes, kills, or deactivates all form of life, referring to microorganisms such as fungi, bacteria, and spores. Contamination, the act or state of making or being made impure or polluting or poisoning something. PPE is the abbreviation for personal protective equipment. You need to know that. Personal protective equipment refers to protecting clothing, helmet, gloves, face shields, goggles, face masks, and other respirators or other equipment designed to protect the wearer from injury or the spread of infection or illness. Here is a picture or an example of PPE. You see this person has on a hair cover or head cover. They are wearing goggles. Here is a picture or an example of PPE. You see this person has on a hair cover or head cover. They are wearing goggles. They're wearing a respirator along with a gown and gloves. Personal protective equipment, donning and doffing is a critical process that requires significant care. Donning means to put on your gown or your PPE, and doffing means to remove or take off your PPE. Your bloodborne pathogen standard. Bloodborne pathogens are infectious microorganisms in the human blood that can cause disease in humans. These pathogens include, are not limited to, hepatitis B, HIV, and hepatitis C. Your standard precautions. Standard precautions are a set of infection control practices used to prevent transmission of diseases that can be acquired by contact with blood, body fluids, non-intact skin, including rashes and mucous membranes. Washing your hands before donning gloves and after wearing gloves is a form of standard precautions. Changing gloves and washing hands between patients when providing care is also following standard precautions. We talked about the bloodborne pathogen standard. He This is the plan that the employer has to have in place um, for the employees. They have to have an exposure control plan, teach universal precautions. They need engineering and work practice controls. Personal protective equipment must be offered. Good housekeeping must be in place. The hepatitis B vaccination is also an option in the use of labels and signs and record keeping. Hepatitis means inflammation of the liver. That's a test question. You need to know that hepatitis is inflammation of the liver. You do need to know that there are three different types. There are several different types of hepatitis, but we're focused on three, which is hepatitis A. It's caused when people do not wash their hands after using a toilet and then they touch or prepare someone else's food. And then you have hepatitis B, and hepatitis C can be spread by having sex with an infected person without a condom. It can be spread by sharing needles or during a needle stick. For an employee that's working at the hospital or from an infected mother to hepatitis virus. Hepatitis A, fecal oral transmission, usually by contaminated food and water. Hepatitis B, blood and body fluids, the same with hepatitis C. Cirrhosis is a chronic disease of the liver marked by degeneration of cells, inflammation, and fibrous thickening of tissue. It is typically a result of alcoholism or hepatitis. You need to know that tuberculosis is a disease of the lungs. Its symptoms include night sweats and bloody sputum. You must wear PPE when you're taking care of a patient that's been diagnosed with tuberculosis. You must wear a N95 mask or a respirator. You cannot wear just a regular face mask. The patient is on isolation precautions. Remember, when they are diagnosed with TB, they're in a negative pressure room. Um, so all blood pressure cuffs and thermometers and other supplies must remain in their rooms. You cannot use their supplies on other patients when the patient is in isolation. You need to know the difference between HIV and AIDS. HIV is the acronym for human deficiency virus, and AIDS is the acronym for acquired immune deficiency syndrome. HIV is a virus that invades the immune system. And then in AIDS, the last stage of a spectrum of conditions initially caused by the infection of HIV. And with HIV, patients will suffer, and with AIDS, patients will suffer, and eventually they will die. So we're going to talk about basic infections in a long-term care facility, and we're going to give credit to Spice, Mrs. Evelyn Cook, for this slide. And so we're going to start off by talking about healthcare associated infections. Are they a problem in long-term care? Yes, they are. There's an estimated 1.5 million infections that are occurring annually in long-term care facilities. These infections result in as many as 350 to 400,000 deaths, and it costs anywhere between 673 million to $2 billion. There is a significant source of morbidity and mortality for nursing home residents, and it accounts for up to half of all the nursing home residents transferred to the hospital. When a nursing home resident is hospitalized with a primary diagnosis of infection, their death rate can reach as high as 40%. Now, long-term care facilities are different from other healthcare settings in that the elderly patients are at increased risk for infections because they are brought together in one setting and they remain in the facility for extended periods of time. Most of the residents, the long-term care facility is actually their home. A long-term care facility is an atmosphere of community. It's fostered in residents share common eating and living areas, and They participate in various facility sponsored activities, and since able residents interact freely with each other, controlling transmission of infections in this setting can be challenging. Residents who are colonized or infected with certain microorganisms are in some cases restricted to their rooms. However, because of the psychosocial risks associated with such restrictions, it is recommended that psychosocial needs be balanced with infection control needs in the long-term care setting. What can we do? What are the basic intervention to help us with infection? We follow our standard precautions and our transmission-based precautions. We have two measures to control transmission. We have our standard precaution and we have our transmission-based precautions. There are four different types of transmission-based precautions. You have contact precautions, enteric precautions, droplet precautions, or airborne precautions. Hand hygiene, soap and water versus alcohol-based hand rub. Personal protective equipment, gowns, gloves, masks, eye protection. You want to wash your hands. There are 5 moments for hand washing. You want to wash your hands before touching the patient, before cleaning, or for aseptic procedures. You want to wash your hands after you have come in contact with body fluid. You want to wash your hands after touching the patient, and you want to wash your hands after touching the environment or the surroundings. For hand hygiene, you want to make sure that you use soap and water, or you can use an alcohol-based hand rub. You want to use soap and water when your hands are visually soiled or you're working with a patient that has been diagnosed with C. diff. You must use soap and water in this situation. You can also use alcohol-based hand rub, but not when your hands are visibly soiled or not when you're taking. So you remember you want to wash your hands with soap and water if your hands are visibly dirty or contaminated with blood or any other body fluids. In order to wash your hands, you first want to wet your hands, and then you want to, after wetting your hands, you want to apply the liquid soap, and you want to rub your hands together vigorously for at least 15 seconds, making sure to cover all surfaces of the hands and the fingers. You want to rinse your hands. You want to dry your hands with a disposable towel, and then use a fresh towel, a fresh disposable towel to turn off the faucet. If hands are not visibly soiled, you can use an alcohol-based hand rub for routinely decontaminating your hands in all other clinical situations. So you want to use your alcohol-based hand rub before direct contact with the patient, before donning sterile gloves, before inserting any invasive devices, after contact with intact skin, after contact with body fluids, excretions, or mucous membrane. If moving from one contaminated body site to a clean body site, after contact with innate objects of the environment, and then also after removing your gloves. You want to apply your alcohol based rub to the palm of one hand and rub those hands together, covering all surfaces and fingers until the hands are dry. Other aspect of hand washing: do not wear artificial nails or extenders when having direct contact with patients at high risk. Keep natural nails tips less than 1/4 inch long. Wear gloves when contact with blood or other potentially infectious material, mucous membrane, or non-intact skin. Remove gloves after caring for a patient. Do not wear the same pair of gloves for the care of more than one patient, and do not wash gloves between use with different patients. Body site. Now we're talking about PPE. PPE is the abbreviation for personal protective equipment. You want to wear PPE when the nature of the anticipated patient interaction indicates that contact with body fluids may occur. You want to prevent contamination of clothing and skin during the process of removing your PPE. And before leaving the patient's room or cubicle, you want to remove or discard the PPE. You want to make sure you keep your hands away from your face. You want to work from clean to dirty. You want to limit surfaces touch. You want to change when torn or heavily contaminated. That's your gloves or your gown. And you want to make sure that you're performing hand hygiene. You want to wear your gloves when it can be reasonably anticipated that contact with blood or potentially infectious material, mucous membrane, or non-intact skin can occur. Remove your gloves after contact with the patient or the surrounding environment. You don't want to wear the same pair of gloves for the care for more than one patient. You do not want to wash gloves for the purpose of reuse, and you want to change gloves during patient care, um, especially when you're moving from a contaminated site to a clean site. You want to wear a gown that is appropriate to the task to protect the skin and prevent soiling or contamination of your clothes during procedures or patient care activities. You want to wear a gown for direct patient contact if the patient has uncontained secretions or excretions. You want to remove your gown and perform hand hygiene before you're leaving that patient's environment. And you do not want to reuse gowns even for repeated contact with the same patient. Your mouth, nose, and eye protection. Use PPE to protect the mucous membrane of the eyes, the nose, the mouth during procedures and patient care activities. You want to be careful when these activities are likely to generate splashes or sprays of body fluids, secretions, or excretions. You want to select the mask, goggles, face shields, in combination of each according to the need anticipated by the task that's going to be performed. When you're donning PPE, you're going to start with your gown. You want to fully cover the torso from the neck to the knees, the arms, and to the end of the wrist. And then you want to wrap it around the back and fasten it at the back of the neck and at the waist. With your mask or your respirator, you want to secure it second. Secure ties or elastic bands at the middle of the head and neck. Fit flexible bands to the nose bridge. Fit snugly to the face and below the chin, and you want to make sure that you fit check your respirators. Third, you'll put on your goggles or your face shield, and then last, you'll put on your gloves. Use non-sterile for isolation. You want to select your gloves according to your hand size and extend them to cover the wrist of an isolation gown. So the order of donning PPE, you want to put on your gloves first, then your mask. You're going to then put on your goggles or your face shield, last the gloves. Dolphin PPE, you're going to start with the gloves, scratching the outside of the gloves with the opposite gloved hand to peel it off the other one. Hold the removed glove in one hand and then slide the fingers on the ungloved hand, remaining at the wrist. To remove goggles, you're going to remove and handle by clean headband or earpieces and place in a designated receptor. Then your gown, you unfasten at the neck and then the waist ties. You're going to remove the gown using a peeling motion. The gown will turn inside out. You want to hold it away from the body, making sure you touch the inside of the gown, which is not contaminated. And then you want to roll the gown away from your body and discard it into the red biohazard bag that's in the container. Mask, you want to grasp only by the bottom or the top ties. to remove, and then you're going to discard it in the appropriate reciprocal. Personal. So, sterile technique is generally defined as meaning free from microorganisms. Clean technique, cleans mean free of dirt, marks, and stains. Clean techniques involve strategies used in patient care to reduce the overall number of microorganisms or to prevent or reduce the risk of transmission of microorganisms from one person to another or from one place to another. We're going to cover the topic of communication. You have several questions coming from this topic. We're talking about verbal and nonverbal communication, the difference. Communication by word, mouth, or pieces of writing is verbal communication. It deals with the use of spoken language to transmit information. It refers to the use of sound and language to relay a message. You have nonverbal communication, which is communication through sending and receiving wordless messages. They are all intentional and unintentional messages that are not written or spoken in the classroom. When you're communicating without words, once again, this is nonverbal communication. It's a process by which an individual stimulates meaning in the minds of another person through intentional and unintentional messages through the use of body and voice. And so here, body language is a form of non-verbal communication, and we are communicating with the outside world through our presentation, our body language. You don't even have to speak to relay a message to another person. On the body language signs, we have 6 emojis showing 6 different emotions. The first one is bored, depression, showdown is at the top, and then at the bottom you have elated, offensive, and then thoughtfulness. Verbal and nonverbal communication play an important role in how people interact with one another. People are using around 35% of verbal communication and about 65% of nonverbal communication in their daily lives. Nonverbal communication also has cultural meaning. So when you're communicating with someone, if you have your hands closed, that means that you're not open to the information that they are giving you. If you have your arms open, then this is a sign of being more receptive to what's being told to you. Here we have a few pictures of some of the different um, ideas or some of the different energy that's being expressed by the body language that's shown in the pictures. And you see here the person with their arms folded, they're defensive um, or annoyed. They can be arrogant. And then also when your arms are folded, you can give off the energy of being irritated. Depending on how you have your arms folded, you can appear happy, confused, or even worse. Types of nonverbal communication is going to be like eye contact, gestures, smile, and facial expressions, postures, and body orientation. The tone and voice of the speaker, body language or movement, and closeness or personal space. Verbal communication is going to be oral, it's spoken language. Um, Non-oral and a non-oral form of verbal communication is written language or sign language, and also Braille for those who are blind and cannot see when they are using Braille. This is a form of verbal communication. Non-verbal communication will be laughing, crying, coughing, um, and then non-oral communication would be gestures, body language, etc. We want to talk about objective communication. Communication. Objective information is based on measurements of the participant responses. Each person uses an objective measure correctly will obtain the same result. And then when we're talking about subjective, this is based on the opinion and largely based on self-reports given by the participant. Often information can't be verified by the researcher when we're talking about objective and subjective. So in layman's terms, objective communication is going to be based on measurements. It's going to be things that you can actually count. You can measure these things. Subjective is going to be whatever the patient says it is or whatever the person says it is. You cannot measure subjective information that can be shared with you through communication. Subjective versus objective. There are many words in the English language that sound very similar but have completely opposite meanings. One of the examples is subjective versus objective. With only a couple of letters different, these two words are actually antonyms. So subjective information is anything that's based on personal opinion, judgment, feelings, or point of view. And then you have your objective information. It's going to be information that is factual and is based on observation and measurements. So you need to know the difference between subjective and objective information when it's being communicated to you. Then you have your open questions, your open-ended questions, and then your closed-ended questions. When you are communicating with someone and you want a short answer, then you would ask them a closed-ended question. And then if you wanted a question, if you want a communication that would be more exaggerated or more detailed, then you would ask a open-ended question. So open-ended questions usually begin with what, why, or how. And then your closed-ended questions, usually the person can answer with yes or no. They're going to begin with is or are or would, could, was, have. These are some of the words that would begin the sentence if you were asking a closed-ended. A question designed to elicit a meaningful answer based on a person's feelings, thought, and knowledge is going to be an open-ended question. How do you feel today is an example. What is your favorite memory from childhood is another example of an open-ended question. It can't be simply answered with yes or no. Another example is how exactly did the fight between the two of you, how exactly did the fight between the two of you start? So these are examples of questions that will require the person that you're communicating with to give you a more detailed response. And then your closed-ended type of questions, a question that limits a person's choice of answers, typically with one word like yes or no. And so examples of these type of questions will be like, are you feeling better today? Or may I use the bathroom? Will you please do me a favor? Or something simple like, can I help you with that? It's important to be active when you're listening. When you're actively listening, you're paying attention, you're looking at who is talking to you, and you're not talking while they're talking. And then while they're talking to you, you want to remember to ask questions. You want to follow the directions that are being given to you during the conversation, and you want to try to visualize what's being said. And when you're talking to the elderly, if you can sit on the same level that they're sitting on, you can get your point across even clearer. You want to try to sit eye level when you're communicating your geriatric population. Remember these things when communicating with the older adult or the resident. You want to identify yourself and you want to look directly at them. You want to speak slowly and clearly. You want to explain what you are doing and what you're going to do before you do it. You listen for the answer that the patient gives you and you show them respect. You do not talk about the patient in front of him or her. You want to include them in any conversations that you're having regarding their care. And remember, with the geriatric patients, nothing happens fast. You have to be. Documenting or charting is a form of communication. Healthcare professionals communicate with one another by documenting their recommendations or plans in the medical record. The medical record is a legal document. When you're communicating with the patient, you want to use language that the resident can understand. When you're communicating with them, you don't want to use any type of hospital jargon. You want to speak to the resident in layman's. Always try to resolve conflict directly with the person you're having the conflict with. If you are still unable to resolve the conflict, follow the chain of command to get assistance from management to help you resolve the conflict. Begin with reporting the conflict with the charge nurse, and you will escalate the chain of command from that point. Conflict resolution is important when you are communicating with your healthcare workers while providing care for your resident.